say so.
I do have 9 o'clock. So do you want me to just do open the meeting and start with roll call, or Kelly, did you have a different idea then on how to start this?
No, that works. Whenever Dawn is ready.
Sure.
All right. Ron Anthony.
Wait.
Oh,
Hang on.
sorry.
Are we live? First,
Yes,
are we live? Okay.
we are
that's-
live.
That's weird. That's what we were confirming.
Ah,
So
sorry.
needs to call the meeting to order and
Sorry,
call
I'm
the
sorry.
roll.
That's okay.
Okay, go ahead.
All right, and or just the hybrid trying to start the meeting sort of thing, right? So yes, we'll call the meeting to order officially, and we will start with roll call.
All right. Ron Anthony.
Present.
Julia Tella.
Present.
Kim Britt. Amber Brown. Molly Bruner.
I'm here and just in the chat, so you know Becca is here but needs to be brought up to a panelist.
I think I had gotten her up. So
Okay.
Becky Bales.
Present.
Michelle Frisbee. Kevin Glass.
Here.
Tracy Green.
Present.
Scott Halverson. Nicholas Henderson. Don Lanoy.
Present.
Jake McClellan.
Present.
Kelly Mitchell.
Here.
Kurt Mortensen.
Here.
Becca Muscat.
She is down in the attendee section.
Is she still down?
Yeah.
I'm sorry. I thought I had. Okay. Give me a second here and I'll. Okay. Okay. Becca Muscat.
Here.
Fantastic.
And then
Don
Michelle
Freeman?
is, oops,
Here.
sorry.
What was that, Molly?
I didn't mean to interrupt you. I can wait.
And John Sherrill.
Here.
Lane Sutherland.
I'm here.
Barb Weckman Brecky. She did say she was going to be a little late. So we do have quorum.
And what I was going to say is it looks like Michelle Frisbee came on after you were calling out roll call. If you didn't have her down.
Michelle, can you hear us? Yeah, I don't see her in the attendees.
I do.
I do.
She's
see
in
her on
panels.
the panel
Mich- oh,
here.
I see her. Michelle, can you hear us?
Do you hear me now?
Yes, we
Yeah.
can. Thank
Okay, I had the button muted, sorry.
you. No problem. Thank you.
All right.
Okay.
Thanks, Don.
Yeah.
So then do we want to shift into the introductions, Kelly?
Yeah, so we do have 2 new members today. I just wanted to acknowledge that last year CSAC looked across at our charge and our legislative what the statute that governs the committee, and we thought that we were missing a few members, so we asked to add a couple, and 2 of them are on board today. So they are Lane Sutherland and Don Lanoy. So I thought it might be a good idea if we say hello to them and give them a chance to introduce themselves. So Lane, do you want to start?
Sure. Hi, everyone. Good morning. My name is Lane Sutherland. I am the Chief Public Defender in the 9th Judicial District with the Board of Public Defense. Recently, I think the signature was official yesterday, so recently joined this group. I did let, I think, Mr. Click know I'm actually we're on a summer vacation, so I can join about 45 minutes this time, but then have to duck out as we're family is headed to Montana. So happy to be here.
Well, we're happy to have you too. And thank you. You didn't have to come on your vacation, but we really do appreciate you showing up. Don?
I'm Don Lanoy. I'm the Sibley County Attorney. I'm appointed to this body by the Minnesota County Attorneys Association.
Nice to meet you. And I just wanted to say for your benefit, so I think the three co-chairs will just make themselves known to you. There are three co-chairs. As you both, I hope, know, the Minnesota's community supervision system has 3 delivery systems. So there's one chair representing each of the delivery systems. So I'm Kelly Mitchell. I'm Assistant Commissioner of Community Services and Reentry for the Department of Corrections. Molly, do you want to say who you are?
Sure. Good morning. Currently, I'm the president of MACAC, and I am the director of community corrections for Scott County.
And John?
And John Shiro, I am the Director of Waseca County Court Services and the past chair for MACPO.
And then do we want to quickly do introductions all the way around? Okay, so we'll so then we're going to do flash introductions for you so that you'll see who we are. But the CSAC is really designed to represent all aspects of the community supervision system and counties who have the need for community supervision. So there's a lot of different positions here, and not everybody is here today, but we'll introduce the folks that we do have, and then hopefully Don has given you a full list of the membership as well. So why don't we start in the room with Kevin?
Hi, good morning, everybody. Kevin Glass, Itas County Probation Director, current MACPO President, and I'm here on CSAC representing the Statewide Evidence-Based Practices Statewide Advisory Committee as the current chair.
And thank you for doing that. So everybody do your name and what position you're representing on the committee. That'd be helpful for them.
I'm Tracy Green. I'm the Director of Probation in Wabasha County, and I am here representing MACPO, which is Minnesota Association of County Probation Officers.
Good morning, Jake McClellan. I am the Regional Manager for the Minnesota Department of Corrections and serve as a representative for the DOC.
Good morning, Kurt Mortensen, Otter Tail County Commissioner. I'm representing the Association of Minnesota Counties.
Okay, then I'm going to pop off the people I see in order on my screen. So Julie Atella.
Morning. Hi, I'm Julie Atella. I work at Wilder Research and I am representing the community research.
Great. And John, you're just here. You're here as a presenter today, right? So I'm going to skip over you. Becca?
Becca Muscat, work for the Minnesota Alliance on Crime, a coalition of victim advocates representing victim interests.
Thank you. Ron Anthony?
I am Ron Anthony, Yellow Medicine County Commissioner. I am appointed through AMC. I sit on 6W Corrections Board, and I'm representing the MACAC counties.
Becky?
Good morning, Becky Bales with Stearns County. I'm representing the MACAC counties. I have to say we just had some thunder and lightning here and my power went out. So I froze up a minute. So hopefully in Stearns County, we don't have any storm damage, but that's where I am today.
Oh my
Hello,
gosh.
everyone. Welcome.
John Preem.
Good morning. My name is John Preem. I'm the Chief of Police for the Prairie Island Indian Community, and I'm representing the Minnesota Indian Affairs Council.
And Michelle Frisbee.
My name is Michelle Frisbee, and I am representing impacted individuals, formerly served on probation.
Thank you. I think I got everybody. Did anyone yell out if I missed you? Okay, turning it back to you, Molly. Thank you.
All right, that sounds good. So the second point on the agenda is the approval of the draft meeting agenda and the minutes from May 28th, 2025. And so we can do those together. So I would either look for a motion to move those, or if there's any additions or changes that need to be made to either one, I would open the floor for that as well.
I would make a motion to approve both.
Okay, I have a motion to approve. Have a second?
Second, Kurt Mortensen.
Second. Thank you, Kurt. Any other discussion? If not, then we can take roll call.
Ron Anthony,
Aye.
Julie Attella,
Aye.
Molly Bruner,
Aye.
Becky Bales,
Aye.
Michelle Frisbee,
Aye.
Kevin Glass,
Aye.
Tracy Green,
Aye.
Don Lanoy,
Aye.
Jake McClellan,
Aye.
Kelly Mitchell,
Yes.
Kurt Mortensen,
Aye.
Becca Muscat,
Aye.
John Priam,
Aye.
John Shiro,
Aye.
Lane Sutherland,
Aye.
and Barb Weckman-Brecky. Okay. And we have a unanimous vote.
Thanks, Don. So the next agenda item is a few points on the loss of the federal funding, and Kelly, you are up.
Yeah, so I'm just going to introduce or just talk about the LSCMI impacts. So I am happy to report that DOC does indeed have the funding to finish the LSCMI validation. So that got, and I'm going to give just a real quick update on where we're at with it too. So the research team is from the University of Nebraska, Omaha. They kicked off the process just before the end of the fiscal year. They have received the data and they're working on the data analysis side of it right now. But then the next part is there's also an inter-rater reliability section. So what that means is we're trying to determine how well we score the LSCMI tool, the risk assessment tool, and are we in agreement when we score it? So are we doing a good job with that? So I'm going to take this second to let the two presidents of MACPO and MACAC know that I will be sending out an email really soon because they need some additional information from each corrections agency in order to work through the data analysis too. So they're looking for things like what cutoff scores are we using right now, and what are our supervision levels that correspond to those cutoff scores. So each agency right now has some different numbers. So I'm going to let them collect that from you guys instead of getting in the middle of that process. And then they will also be wanting to conduct interviews, some interviews. So they will also, I'll be giving them your contact information so they may reach out asking for some interviews from your agencies. But I think everything is moving along. We had been, that was scheduled to be done by about September, but because we got it took a while to get it off the ground. We are going to extend the date for that into next year. So into 2026. So I think that their goal is to try to get it done in the January-ish timeframe, but it really depends on, how things go with data collection and all the next steps over the next few months. So it could, take longer than that. But we're on track, I think. So if there's any questions, let me know. And what's the next one?
The case planning
Case planning.
development and update. So I think Jake and I were going to probably piggyback that one, but as everybody likely remembers here, so the case planning project was a project that was developing a module within our data management system, CSTS. So that the module was developed, but we were just kind of looking for the funding. DOC did have some funding available within some of their funds to help get us up to July. So they were able to, work with STI, who's our data management system IT company, to create the module within that data management system to a certain point. So they have it up to, I'll call it maybe a silver standard right now, right? We're not quite to our gold standard, everything we wanted in there, but we got us to a point where it's ready to be installed into our CSTS system. So the next process will be working with the CSTS executive board meeting to figure out when we can or have the enhancements, so it's put into our data management system. We have a enhancement list that the executive committee approves, and it's all based on funding. The idea is hopefully early next year that we the case planning module will be approved, and hopefully it'll be installed for one of our updates for early to mid next year. Jake, did I miss anything?
No, and maybe just some context that the CSTS Executive Committee is a collaboration of all three delivery systems and STI. So there are fees that go into for each agency to build an account to take care of and manage enhancements. So this is an enhancement. Like John said, we have the case planning module available, but where we need it to be in relation to the standards and expectations that are coming from what we're going to probably review today, the scope of being able to pull that off now, given there are other priorities, specifically earned compliance credit calculator that we need to account for. So looking at the next calendar year, I think we're going to have a pretty robust strategic planning in relation to how we dedicate funds towards this specific project, as well as a mountain of other enhancements that come through on a daily basis that are vetted by an enhancement committee that raise itself up to the CSTS Executive Committee. And the Exec Committee is the group that approves the expenditure of those funds towards that. So there's multiple rungs of different governance in relation to kind of all the things that happen with community supervision, that one specifically, just to give a little context of when we throw terms out like CSTS exec and standards, enhancements, things like that, just to understand that there are just these steps along the way that we need to make sure that when we want to change something, we have to really identify what are the standards behind that, meaning is it something that we put some definition to and expectations to ensure everybody does it the exact same way. So data integrity is a big piece to the CSTS executive, as well as ensuring that the changes we make are within the scope of all agencies' benefit.
Any questions? Thank you, Jake.
And I think the last one there is the chair assignment updates, and Don's on the list for that one.
So I was asked just to go through and give everybody an update on who the co-chairs are for the JRI2. And it's for DOC's representative, it is Tracy Pederlik. Is that correct? Okay, thank you. And for MACPO, it's Rhonda Van Schoonhoven. And for MACAC, it's John Marsalik. I got that one right. And then for the Risk Needs Committee, we've got the DOC rep is Tessa Nelson. The MACPO rep is Eric Johnson. And the MACAC rep is Dennis Stam.
All right. And it sounds like both committees have recovered from losing CSG leadership and are moving along. And in fact, we have some of their labor in front of us today. So I'm pleased to report that seems to be moving along. All right. Are you in the next section?
You listed, but I thought I was. So
yeah.
So what we'll do now is move on to our presentations on the draft policies and document review. So we do have a number of presentations from committee members that are here for us today. We would ask that each person presenting try to keep it around that 15-minute presentation. We'll follow that up with maybe a 15-minute discussion from the committee with any questions or topics we may have. And then keep in mind, after this, what we're doing is we're just getting a presentation on the policies right now, or the draft policies. Within the next month, we'd ask that each person kind of bring it back to your respective representative committees and vet it through your committees or your organizations at that point. And then next time we meet, we would likely be voting to approve, or maybe if there's any adjustments needed at that point, we'd come back with that feedback. So
remember, we changed the order.
we did. Oh, yes, thank you. So we will start with the draft training, coaching, and quality assurance policy with Kevin Glass.
Thank you. And I have Bridget as well, joining me for this presentation. So,
Oh, if she's, are you presenting? Because you can come up here if you want to.
If I want to, is that?
It's voluntary. We don't force anybody to come to the table if they don't want to.
so some background on this while Bridget's gonna join us is this deliverable that CSAC has been tasked to do, has tasked the Evidence-Based Practices Statewide Advisory Committee to take on this deliverable number 8 and make recommendations. Last year, we did make recommendations to CSAC. CSAC then forwarded that to the Commissioner of Corrections, and then the Commissioner of Corrections give a written response with kind of outlining next steps. And from that, this is what we've come up with. Excuse me. And so now this is the policy. So I will read some of it. So the title, and this comes from the Commissioner of Corrections, statewide evidence-based practices training, coaching, and quality assurance system. Effective date, we have to be determined. Purpose, to create a consistent framework for statewide community supervision agencies that provide training, ongoing coaching, and quality assurance and evidence-based skills to increase knowledge for practitioners, improve client outcomes, and promote public safety. Applicability, Minnesota Community Supervision Agencies. So every agency in the state of Minnesota would be required to follow this policy. Even though it says that it's a DLC policy, all agencies will be required to follow it. Definitions, and this is where we might have some feedback, or I already have received some feedback regarding definitions, is there's other deliverables and policies, recommendations coming forward. And so some definitions maybe vary a little bit. So we do want to have all definitions standard, all of them being the same. So that is some feedback that we have received already. And so there may be some tweaks or adjustments that need to be done with the definitions. So I don't know if you want me to read the definitions or if.
I think we can review those ourselves and we can bring back any feedback next time.
Is there any significant changes or differences between the definitions that we've seen in other policies, or is it just more?
Just some wording, yeah, nothing. I mean, they essentially all mean the same, just different wording here and there. And so the 5 required initial base level training, this was already put in place. And so this is kind of straightforward. So all agencies require initial base level training for new supervision agents and supervisors, if not previously completed, within the first year of employment in the following 5 EVP skill areas. And I should note, supervisors were not initially part of that. It was agents, and we added supervisors as we feel it's appropriate that supervisors supervising the staff that are required to do this also be trained in the skill sets. Motivational interviewing 1 and 2, for correctional practices, validated assessments, cognitive behavior interventions, and case planning. All agencies will require all applicable staff participate in a minimum of 16 hours per year on ongoing EVP training to support skill development and develop, maintain proficiency. Agencies will determine relevant EVP content for approved hours. And the 16 hours was a recommendation and supported by the Commissioner of Corrections. And that's where the 16 hours has come from. C, all agencies will provide integrated EVP coaching with staff to ensure consistent application and support development of EVP skills and principles following initial training identified in sections A of this policy. And D, All agencies will conduct quality assurance measures and report applicable data to stakeholders around use and effectiveness of EBP skills, principles, training, and coaching. And this can be done through the comprehensive plan the agencies are required to complete. Internal controls, DLC will offer statewide training academy and document training participation. And all Minnesota community supervision agencies will document compliance with these requirements in their comprehensive plan. And then our next part goes into the attachments, which is the implementation considerations. And note, the implementation considerations is not policy. It's not a recommendation that all agencies are required to follow this. It's basically the base level of how they can do that. And if they want to take next steps in advancing EBP framework, this is how they could possibly do that. So I'll turn this over to Bridget, who's an expert in this field. Expert.
It's a lot of pressure. Do you want to do questions on the policy first? Or no?
Sorry, what'd you say?
We can, do we, so the question was, Bridget asked, we want to just maybe ask questions on the policy first and vet through that real quick. Then we can maybe go into the implementation. So any questions or comment on the policy itself?
Madam Chair, this is Ron.
Yes, Ron.
I say, a question I have, and you might be addressing this in the further part of this presentation, but I'm asking because of the quality of people who are sitting in this room. Is this achievable, and are these things available to everyone? I mean, I'm out in greater Minnesota. Sometimes I hear things that some of these programs aren't even available for some of us. Can somebody address that?
I can address that. So I'm from Itasca County, rural area. And so keeping in mind when we made recommendations with this, we looked at, your Hennepins, your Ramseys, the large counties, and we looked at like your Pope counties, agencies that might have 2 staff. So when looking at this and developing this policy, we thought about what is something all agencies can support and do if you have 100 staff or if you have 2 staff. Is it realistic and achievable? And to answer your question, I would say yes. With these recommendations and this policy, all agencies can do this and should be able to do this without issue.
Thanks, Kevin. Thank you.
And if I can add to that, I think that one of the reasons it's achievable is because we do have the statewide training academy. And so those core courses are offered in that venue, right? So that's even if some agencies do have the ability to bring training in for their own agents, but statewide training academy is there for agencies, for all agencies, and we'll always be offering these, right?
And can I just add to that? One of the things we're going to pilot, which of course we didn't have the luxury of piloting back in 2020, but we are looking at 1 virtual academy per year and then 1 hybrid. So right now, for the past few years, we've been doing hybrid model of statewide training academy. So we have 2 weeks at Camp Ripley, which of course is central Minnesota. And then the rest of statewide training academy runs virtually. We are looking at an all virtual academy for our first session every year. So we're going to pilot that in January to see how that goes. Some people appreciate virtual training, some people don't. And so we'll get some feedback on how that went. But we have learned over the past few Januaries, especially in Februaries in Minnesota, it's tough for people to always get to Camp Ripley. We've had cars not start while at Camp Ripley, and now people are stuck there. We actually had a couple falls last January. So we're just looking at, especially for staff and maybe agencies that can't necessarily fund the Camp Ripley portion of that. We'll have some virtual opportunities at least once a year to complete statewide training academy too.
My question is, Tracy Green here. The coaching isn't able to be done through the training academy. And I'm hoping, and I know we've started some discussions through MACPO, I'm hoping that we can do some sharing of those resources. For example, I have 4 agents in my office. It's hard for me to have a coach in my office. And I also think in a small agency like that, it's hard to have your coach as your colleague. So I'm hoping that we can open up and have some more opportunities for that coaching, so that we can, amongst agencies or statewide or district-wide or whatnot, look at more of those opportunities. I totally agree. All the other courses are available statewide through the academy and through different boosters, et cetera, around. Where it somewhat becomes somewhat of a challenge is that coaching, but I think that we've got good communication amongst us that I think we'll be able to accommodate effectively.
Yeah, I mean, that could definitely occur cross agency. I would assume, like, you know, Sherry, like coaching circles can be
Yes.
something that agencies can partner on, right? That kind of thing.
Correct.
And that has been, and just to follow up with that, there's all three delivery systems and all associations are meeting and talking about, hey, how can we collaborate to provide some of that that necessary training to kind of enhance all the agents in Minnesota. So how do we work together? Couple comments. Number one, I appreciate the I'll call it simplistic or the generalization of the policy. I think that's what originally that CSAC recommended. I do like that. And then I do like the follow-up of the implementation considerations. Hey, these are some great considerations you can look at then to get to. I think they're extremely helpful. The only thing I would say is, and I thought maybe on an early version, but maybe defining integrated EBP on the policy might be helpful. That's not, I didn't see that in the definition. And some people might ask what that is. I know you've seen it, and I think it's even in the implementation considerations, but just having a definition on there might be helpful.
Thank you.
We did have a definition at
There
one
was at
point.
one time. That's what I
think we
thought.
must
Yeah.
have-
Yeah.
I think we got some other feedback that it was confusing between.
Oh, yeah.
It's just
Yeah.
the coaching
Yeah.
model, right? So.
Yeah. Yep. So other feedback.
You have two
Oh,
hands up.
we have two. Sorry. Yes. I didn't see who was first, but maybe Molly. Oh, you're muted, Molly.
I was going to defer to Becca first.
Oh,
And I was
Becca?
deferring to you.
Becca, you're up.
I was just curious if we could get the curriculum that's used in the statewide training academy. I'm just curious as to just whatever the latest one was. I'm curious as to what that looks like. And then I don't know, maybe if that could go with this policy of like an illustration of here's how we're hitting all of these core principles. With here's an example of what we do in the statewide training academy, just as maybe just a supplement to this. I'm just personally very curious as to all the different classes.
I'll hand that over. Who's our expert in the Bridget?
Well, so is the question the actual curriculum? Because those are awfully lengthy for each one of those. But certainly we have just a calendar that kind of lays out the STA schedule, or kind of the agenda, or what's the word I'm looking for?
The outline or
What is it?
outline?
Yeah, outline.
Syllabus.
There's a better
Syllabus.
syllabus.
There you
Thanks,
go.
Jake. Like there's a better word for that.
Very sweet.
Syllabus that outlines that for each of those. I'm not sure. I mean, we definitely have the curriculum if you'd like to look through that, but
Yes, maybe that was the better word, is syllabus.
Okay.
Yeah, just sort of a listing of what are the courses that they take and how do they fit into each one of those, how do they fit into those categories would be just helpful for me.
And
yeah, the training is actually called those. So like, well, actually, so Statewide Training Academy starts with day one of case planning. Well, actually, they have an intro day and then day of case planning. Because case planning is broken up into several sessions now, but then we move into something literally called Motivational 1 or Motivational Interviewing 1. Then they do core correctional practices. So the names of the trainings are actually those 5 buckets of training.
So probably the syllabus is going to give
Absolutely.
a little more detail. That sounds,
Sure.
that looks good.
and maybe the length of hours
Oh, yeah.
would be maybe helpful in that too. You know, someone may take a class called Motivational Interviewing 1, but it's not what we have as Motivational
Right,
Interviewing 1,
yeah.
or some of those core correctional practices. So what we've got is the number of hours might be helpful.
Thank you. Molly, you had your hand up also.
Well, I think some of it is echoing what folks said. And I know we're bringing it back to like our delivery systems too, to come back next month around it. I think to me, I appreciate, the training academy, access, collaboration, as everybody discussed. I still have the same question really that Commissioner Anthony has about like that 16 hours of ongoing and what that means, and like what happens if it's harder to collaborate or people are doing it in person and people can't get there, and are we able, is everybody able to, especially smaller jurisdictions, get there? So I'll just be interested in checking in with our, folks to verify that that's in fact, true and accurate, that that's attainable, I guess.
Thank you, Molly. Any other questions, folks?
My one question as the person who has responsibility for developing the outline of the comp plans is, what did you envision for quality assurance? Are there any key metrics that every agency should be looking at for quality assurance? Because it would seem like there might be at least a couple of core measurements that we could identify that everybody should be doing, and that could be, I heard you say, Kevin, reported in the comp plan earlier, so maybe that's the place where we have that baseline. So I just wondering if you had talked about that at all.
We did. We didn't. Well, yeah. So go ahead, Kevin. Sorry.
Well, I was just going to touch on some of them. Absolutely, we can show quality assurance. So, like for the example, the LSCMI or YLS, we're going to have boosters, and you can show like staff were proficient in it and they're able to pass and things like that. So that's an easier documentation that we can say quality assurance wise staff are being receiving boosters on the validate assessment. So that'll be under the validate assessments. The LSCMI would cover that. The motivational interviewing 1 and 2, and we can identify that staff are being trained in it. Ongoing quality assurance, we could say like at least once a year, they're doing coaching circles. And that's how we're having quality assurance that they're ongoing utilizing the skills. So we can identify that in the comp plan that that's how we're meeting that. And other like boosters,
case planning. We'll be eventually getting to a point of data for case planning for our high risk individuals too, for utilization and application.
Thank you. Yeah, so some of them are still kind of ongoing, but some like we can identify pretty easily. And I don't know if did I answer your question, Kelly? Well, some of them might be a little trickier maybe about the like core correctional practices. Continue that.
Yeah, I think that the question comes back to is we can absolutely add metrics here. I don't know if that was because I think we did originally, and then we wanted something a little more general and weren't sure if all agencies would be able to measure the metrics from some of the original drafts. But if you want some basic QA metrics listed for the comp plan or some kind of template that would help with some of that, I would be happy to help address that. I think the question is what metrics will you guys agree on, and then we'll stick it in there. Because there's a ton, right? You can do quality, you could do quantity, you could have a mix of both, anywhere from very specific, am I coding for each staff, all the way through like, recidivism itself is a metric.
Yeah, I appreciate that, Bridget. I think that was in line with us going back and forth, staying general enough that we're following something, but not being overly prescriptive, especially if there's a fiscal note to it that we weren't sure agencies, especially the coaching, the tapes, like all of those sorts of things. Mm-hmm. I'm wondering if that gets into your implementation guide. Is it like, here's a list of options, and I know it's in there, like all the suggestions or things to consider. And then that's what we use as what can we accomplish in our jurisdictions related to this, and put that in the comp plan?
Yeah, it's not specific in the implementation guide, and I think that there's probably a couple problem areas for what you are talking about that wouldn't align with that necessarily. So like one of the, under quality assurance number 2, maybe not. Now that I'm looking, somewhere in here, we talk about, maybe it's under coaching, but staff that don't meet proficiency guidelines, right, score low. It just says score low, and I don't think that there's any agreed upon, like, what does low mean across the state. So we'd need to look at that, but the idea, right, remains the same, that, you know, staff that are maybe challenged or struggling with proficiency, we would want additional coaching for, or some additional measures in place around refreshers or just additional coaching. And then the second one is under that number 4 for QA. It just talks about, right, we'll capture, report, analyze data regarding use of assessments, interventions, and case planning, but again, doesn't specify what those are. So if we want to be a little more specific in either of those, I think those would be a good place to start that conversation.
I guess I will just throw it out, food for thought for the committee is, if we're recommending a policy and the policy says agencies shall do implement quality assurance, the question is like, is there like some measure for any of these policies that we want to make sure that they're at least doing that? And that's, you know, because it's sort of like, what are the teeth in the policy if there isn't something, right? And I can be dissuaded and I'm throwing it out for food for thought. Like, should we, for all of these, have something that might be a key metric that we want to make sure everyone is doing?
Thoughts, feedback? Yes, Becky.
Thank you. And so I just want to go back exactly what you said, Kelly. I'm in support of the policy. I think where I'm struggling a little bit is the implementation, and maybe it's just the wording of it. I agree with a lot of what it said in there. It's just, is it feasible to do those things? And just some of the wording seems like it's more required. It's, you know, shall do this or must do these. And it's very detailed. And I think having more of the principles on how we get there. So coaching, like Tracy said in her shop, might look a little different than it does in Hennepin County. And I think that's okay. And I think that also projects into the future when we talk about, we don't know what coaching is going to look like in 5 years or in a year. And there could be a new technology, there could be new partnerships, there could be a lot of things. And this just seems very detailed in those areas. But I also hear what you're saying about metrics. So we put this in place, but if nobody's doing it, then what? I still think that the policy is good, because that, I think, is something that we can all get behind and start, and then revisit those metrics maybe down the road. But I think we need to start somewhere. That's my first thought.
Thank you, Becky. That might be a good transition into the, maybe going over the implementation considerations, unless there's anything else specific on the policy. If not, we'll turn it back over to Kevin and Bridget to go over the implementation.
Sure, and the implementation considerations are really designed to be kind of that helpful guideline. So if it's just the wording on kind of what you're talking about, Becky, if it sounds too requiry or whatever, like I think we can play with some of the words to loosen that up. But it was really just an opportunity to say, look, you know, if you're looking for motivational interviewing training, this is, you know, these are places to get them, or this is a opportunity to get that training. So like number 1, MI1 in coaching circles, which is MI2, which is a series that is done across the state. Those are both done at Statewide Training Academy, in addition to some of the other agencies that do their own MI training. And then C, there is a minimum of 1 recorded sample of MI skills and participate in a follow-up coaching session. So again, just an opportunity to say, you know, after MI1 and MI2, do one session a year to look at some MI skills. That can be recorded and then provided to the coach. Number 2 there, core correctional skills end user training. So at STA, or Statewide Training Academy, we provide a specific curriculum called Core Correctional Practices that was designed by University of Cincinnati Correctional Institute. But that is not the end all be all. Like, core correctional practices, lowercase, is really just the research from the 80s and 90s and so on, that are those 8 core correctional skills. So it doesn't have to be core correctional practices, uppercase, the current curriculum. And I know that there are some agencies that have their own CCP or core correctional skills curriculum. So we hopefully have the language in there that works there. Validated assessments, initial user training for LSCMI or YLS is the youth version. If we have staff that are working with juveniles, doing the YLS CMI with that staff, there's initial user training that we have agreed upon with the authors of that assessment tool that we do across the state. If there are other validated assessments here in B that agencies are using, such as the DRA or Dynamic Risk Assessment tool, any gender responsive tools, IPV tools, anything, right, that staff just are trained to deliver those prior to starting to do those assessments with clients. C there is participate in annual scoring exercise. So if you've been around long enough, you know that I think every other year in previous times, although we haven't done it for a while, we do something called proficiency for the YLS and the LSCMI. That's kind of what we're talking about here, is that proficiency where staff get a kind of a mock client and they review that, review all the information, and then score an LSCMI or a YLS for that staff. And then it's then we look at that holistically. So not only how well is that staff person doing, but across the state, right? How well are we doing? And is there anything in our training or refreshers that need to be modified because we're not hitting a mark somewhere? So it's good information to have there. D, provide refer applicable staff to attend annual refreshers and assessments. If you work out in the field right now, you know we are knee deep in LSCMI refreshers at the moment, and we'll continue to offer those. We have a phenomenal LSCMI work group of the lead trainers there. We have a master trainer within our unit here at the DOC that leads that group that works on those refresher trainings. Anything for sorry, went through those fast. MI, CCP, or validated assessments on page 1 there?
Any questions or comments?
Page 2 is CBI, so cognitive behavioral interventions, and this really gets into the one-to-one interventions. So some of that is actually done as part of core correctional practices training. We have one-to-one interventions that are taught in that training, such as behavior chains, problem-solving skills, social skill development. But there are other tools that are used across the state, carry guides, multiple tools used that don't necessarily cost an arm and a leg to deliver. So just some language around that. Case planning, there is a statewide case planning curriculum that was just recently updated, and that's provided at Statewide Training Academy in addition to agencies that do that on their own with their staff. Questions on 4 or 5?
Nope, not seeing any.
Okay, and then it does get into coaching. Maybe here's where we saw those definitions before too. So having a coaching plan that supports skill development. So individual EBP coaching is really about how do we work with staff on each one of those 5 bucket areas within coaching. Some of that we actually do within the training. So for example, core correctional practices, they practice and we provide feedback within the 2 days of that CCP training. MI, for example, MI2 does require a tape as part of that that session where they're provided peer feedback and coach feedback there. Case plan training, also they do a tape and case plan training, yeah, Jake? And provided coaching and feedback by both peers and the trainers in that as well. So there's some individual EBP coaching that happens within that initial training. And then integrated EBP coaching is really about, right, how do we put it all together? So we're not necessarily separating those buckets of skills, but what does a session or an appointment with a client sound like and look like if we were to integrate MI and assessment, or MI and a behavior chain, or any of the CBIs and kind of case planning. So that's kind of the difference between individual and integrated there. So the recommendation or the consideration is really about just developing a coaching model that includes working with staff to deliver or to increase their individual proficiency, but at the same time, kind of like what's the overall coaching model so that we are able to observe sessions with clients and provide coaching that way, or having those tape sessions and do it that way too. I did just want to touch on, coaches don't necessarily just have to be trainers in those curriculum too. There are certainly coaching training across, there's a number of different opportunities to become a coach without necessarily having to be a trainer or a lead trainer or a master trainer too. And sometimes training looks different than coaching as well. So there is just specific coaching training that can happen to help staff become, a coach, whether it's a peer or a supervisor as well. Oh, and the coaching sessions can count toward the 16 hours of EBP refresher requirements as well. Wanted to add that in here. Moving on to the QA piece, then I think we've certainly talked about that a lot. Part of it is just documenting what people are doing for that 16 hours of ongoing EBP refresher. The recommendation is at least 12 of those 16 hours are practice hours. So that might look like a communities of practice or attending a refresher where they're actively participating in such as a scoring exercise or practicing doing a behavior chain. Or a cost benefit analysis, something like that, but actively practicing and then provided some of that feedback. But opportunity too, right? There's a number of webinars that sometimes we just sit and listen to for an hour and a half and can learn a lot from too. But the recommendation would be at least 12 of the 16 are really practice opportunities for staff. And then we have the annual QA exercise and number 2 there. If agencies use specialized assessment tools, which they certainly can with some specialized populations, that obviously they do their own QA, whatever that tool is recommended. And that's a pretty vague a vague consideration there, but being able to list out every single specialized tool and then kind of what the QA on all of those look like probably isn't practical for this. So again, just considering that if you have agents that use specialized tools for specialized populations, that they continue their proficiency in those tools as well. Number 4, we kind of already talked about how vague that is, but that agencies will capture data regarding the use of assessments, interventions, and case planning through CSTS or other avenues, if applicable. And 5 and 6 really refer to group quality assurance. So if an agency facilitates cognitive behavioral groups, that coaching and training for those facilitators of those groups also continues to happen, right? There's a statewide facilitation skills for correctional treatment groups that's offered. Certainly there's other facilitation skills and increasing facilitation skills training that could happen, but really that there's also observation and support for group facilitators. We are starting to look at what that could look like within the EBP unit at DOC anyway. I think in this state specifically, we have supported our trainers very well. In our EBP curriculum, we have not necessarily done much with the number of facilitators we have in these curriculums. So really being able to support them and making sure, right, that the delivery of those groups are on point, and they're getting their feedback and coaching as well for those individual curriculums. And then number 6 is more of a big picture measurement around recidivism, desistance, and/or we wanted to add and/or success for group graduates, because it's not always necessarily about recidivism, but our clients reaching goals that they may have had, or what looks differently for them because of the group that they attended. What does success look like for them? Maybe I'll stop there.
Any questions or comments on the implementation considerations?
Hi, this is Julie. Yeah, this is great. I just wanted to kind of reiterate what I think was talked about around the metrics piece. And I know that sometimes collecting information about what people have learned and, having to compile it in different ways can be a missing piece. And I think it's probably an important piece, as we've kind of already established. So I was wondering if there was maybe even an evaluation or something that was like a survey that was given out after a training where you might be able to collect some of that information. And if there might even be a template or something that could be created for people to report back, like on a whatever the basis is, quarterly, annually basis, so that you are collecting kind of consistent things, even if they are more narrative or qualitative.
Yeah, some of the curriculum has built-in kind of pre and post surveys that address a little bit of, I think, of what you're talking about there, Julie. And so again, it could just be again, one of the considerations, right? If you're using one of those curriculums that have that built in pre and post, I know that new Thinking for a Change 5.0 version has that built in, that those be added to that. I like that a lot.
Thank you. Becky, you have your hand up.
Thank you. And like I said earlier, so I don't want to repeat myself, I do think these are ideal and these are awesome. I look at things like number 6, the cognitive behavioral programs. We're trying to measure recidivism, and we're a pretty big shop in Stearns County. I just don't think that the whole state it's going to be a while before we can do that. And then I also think a lot of the folks at least in our area, will do cognitive groups through our staff, and then some will do them through the community too. So to me, it's a big project to try to measure recidivism, not just our internal groups, but also in the community. I know one of the things that we've talked about over the years is, what are the programs happening in the community? Are they effective? I just see this as like really ideal and good, but I don't see it as something that's, well, at least we can take action on for a while. And I want to say thanks, Bridget, I really appreciate the support with the EBP statewide group, because things like supporting the cognitive facilitators, I think, is helpful, as you've been doing with the trainers. I think that would be really good for coaching. So there's, again, really good things on here. It's just as when they can be into practice. I'm just not hopeful all 87 of us will be doing these things right away. So just the wording on it, with instead of maybe we'll do this, but this is ideal, and ultimately we want to get to it. So just wanted to make those comments. Thank you.
Thank you, Becky. Any other comments or questions? Well, thank you, everyone. Thank you, Bridget and Kevin. So what we'll do, and one good question I think to ask when you bring it back to your organizations, is that metric question too, is for the quality assurances, is that CSAC talked a lot about quality assurance, and are there certain metrics, maybe specific metrics at each level that we all can agree upon to collect? So that'd be a good question to bring back. So thank you. We'll move on then to draft case planning policy with John Marsalik. Is John with us? John's got the next 2, I think.
Can you hear me now?
Yeah.
We can.
All right. Yes, thank you for having me, excuse me, today. And I'll be presenting the case planning policy. And then I'll actually be turning it over to, I believe, Tracy Huderlich is in the room, correct?
Yes.
She
Okay.
is.
Okay, good. So then Tracy, I believe, will take over for the behavior response grid memo after I talk about the case planning policy. Does that sound good?
Yes.
All right, so I can jump into it?
You absolutely can. All you, John.
Great, thanks, John. So just to get us started here, we had a subgroup. So I'm tri-chairing the JRI Phase 2 group alongside Tracy and Rhonda. And then there was a subgroup who worked on the case planning policy from the 3 delivery systems. So the purpose of the policy is to establish guidelines for assessment-driven collaborative case planning across all community supervision delivery systems in Minnesota. And a lot of this, obviously, people can take a look at and read as we go along. But I think that some of the comments I've been hearing in relation even to the work that the EBP group did, that Bridget was presenting, is a lot of the discussions, it seems like we were having ourselves. And so I just wanted to kind of mention that right away too. Like a lot of these things, it feels like we are experiencing similar things just in different circles. But just to continue, the goal is to ensure fair, equitable, effective, and consistent supervision practices that focus on identified criminogenic behavioral health needs for moderate and high-risk individuals, promoting behavior change, reducing recidivism, and enhancing public safety. So the applicability is obviously our next section there. And then we get into the definitions. And I believe Kevin mentioned while he was talking earlier as well, I was one who reached out to, after their policy came our way, and I kind of set them side by side with ours, and I thought, okay, some of the definitions aren't matching up. And I think it's just something for us to take a look at and make sure that across the state, when we are developing our policies, that we are making sure that all of our definitions are lining up consistently. So there was a few, and I think CBIs was one of them that did not have kind of consistent language across the board. And I think Kevin, nailed it too when he said it's not like they're completely out of line. It's just like we're just not matching our language there. And so I think that's just one thing that we see when we're all working in our own areas and developing our policies is that we do tend to, we're defining things, we're creating definitions, but it's not the same definition that the group, from the EBP group would be using. So just one of the things that we'll have to take back and take a look at. Not sure if there's any comments or any thoughts that anybody wanted to bring up right now in regards to that, but just something that I noticed along the way as we've been developing that.
Thank you. I think we appreciate that, John. That's a great idea. So,
all right. So jumping into the policy, then I'm going to scroll down because that's a little small font here. So the policy, as it reads, all applicable clients shall receive a case plan that is assessment-driven, targets criminogenic needs, and is responsive to individual strengths and barriers. The process will align with the R&R model and utilize the CSTS platform for documentation and ongoing updates. So this has been a topic of discussion that was addressed earlier in the meeting. The CSTS platform is to be used for documentation as it relates to case planning. You guys spoke to the enhancements and the work that's being done there, and there's been a subgroup out of JRI that's been working on those enhancements. The plan must be a joint effort between the probation officer and the individual to maximize the likelihood of success. So we get into our key components as it relates to case planning. I'll just note under A1, the agent shall case plan with all high and very high risk clients under supervision, and as capacity allows, agents shall case plan with medium risk clients. This has been a topic of discussion around medium risk, and there's been feedback from the commissioner, I think, in this regard. And I think at times there's been this debate, I guess you could say, of how we are able to, where will resources allow us to case plan with our medium risk clients. And I think also part of this goes back to the LSCMI validation and how we're going to define medium risk coming out of the LSCMI validation and what that's going to look like. And so we tried to be using language that isn't, and I think the group has spoke to this, we don't want to be too prescriptive. And so we just use language that identifies high and very highs, and then as capacity allows with medium risk clients. And then number 2 there, as the case planning process shall be utilized and documented at each planned visit when applicable. Just a note that we did receive some feedback There had been some more prescriptive language here, but we did change that to kind of broaden out the scope a little bit, which in general, and I guess it does seem that the feedback from the CSEC as well is trying not to be overly prescriptive, establishing a base as it relates to the policy. So, if there's any continued feedback in that regard, I think we are definitely open to that. All right, getting into the case planning process that incorporates just various aspects with things such as, engagement, assessment, feedback. And we try to use, again, we're using language here such as. So we don't want to be overly prescriptive and say that it has to be a very certain or defined case planning model. You may use 10 steps to risk reduction in your own shop, and that's completely fine. And we just wanted to make sure that we're giving some definition, but yet also making sure, we want to make sure that this isn't boxing people into a certain aspect or a certain type of case planning that they need to be using. Obviously, we know what most staff are trained on in the state of Minnesota, but we wanted to also be open. Assessment-driven approach, utilizing a current validated risk and needs assessment, and again, such as the LSCMI or similar tools, and it can also include trailer tools such as the DRA. And assessments will guide prioritization of intervention targets and intensity of supervision. So again, getting into the criminogenic needs, targeting the central 8. We had received some feedback after we sent this out, just as it relates to this part of the policy. And we just outlined the 8 criminogenic needs in the policy as well. We did make mention of non-criminogenic needs that may be addressed as part of case planning. It's a topic of discussion, but it is included here as well. Alignment with the R&R model, the risk need responsivity principle, and we also included some just more specific information about general responsivity and specific responsivity as part of our policy when we were writing that. Then we get into the integration with CSTS. Again, this is something that the group's been talking about with the enhancements as it relates to case planning. And the case planning process shall be documented and updated within the CSTS system. I've had some conversations with Carter. When we met as part of the larger JRI FASU group, they provided an update on the work they've been doing there and where things are at. One of the things that's, I would say, tricky is to be developing enhancements to CSTS while also trying to write the policy. Just trying to make sure we're not, we're running parallel to each other. And so we're just trying to make sure that we're on the same page. And so that's been something we've had to kind of check and connect and make sure that things look the way they should. But again, when we're writing the policy, we're trying to make sure that we're not being overly prescriptive. CSTS will be used to record assessments, interventions, case planning process, goals, action steps, and et cetera. Highly recommended the staff be trained in CSTS functionality relevant to case planning and documentation. Had a little bit of discussion about this. There was, some language that was kind of saying staff needed to be trained. We just, kind of tweaked some language here to say it's highly recommended. There's some things that we've seen in other formats as well, talking about how you utilize, if it's like the behavior response grid, to make sure that you are offered some semblance of this is the how or the why you document these things within CSTS. And so that's what we have there in relation to kind of the training and the functionality. Roles and responsibilities covers probation officers, supervisors, and administrators. And then training, this comes from the training expectations as it relates to academy. So we did have some different language in here. I think we just had maybe 2 or 3 things that were mentioned here. But going back to what is expected as part of statewide training academy, that's where we pulled in these items to bring into the policy here. So those came from the statewide training academy group. Quality assurance and review just goes into language about the expectations as it relates to supervisors conducting periodic audits of case planning and CSTS, collecting and analyzing data and key metrics. Some of this goes back to, again, what enhancements we're able to do and the data that we're able to pull and can already pull some of this data out of CSTS. And so it kind of goes through some of the various metrics that could be measured as it relates to CSTS. And then the data being used to inform continuous quality improvement efforts. And I think this isn't included here, but one of the things I believe we may have talked about, or that we did talk about at the phase 2 meeting, was in relation to the comprehensive plans and the data that should or will be a part of our comprehensive plans as it relates to the case planning deliverable. And it's not spoken to in here, but that's just one of the things that we were having discussions about, is that we want to make sure that the policy does also push towards what we believe will be the expectations coming out of the comprehensive plan as well. As it relates to the procedure, we did have more language in the procedure, but we pulled that back and we went with individual jurisdictions to develop their own local procedures as it relates to case planning. So we had some discussions about making sure that, yes, we have a policy, but also allowing counties and jurisdictions to develop their own local procedures to have some autonomy in that regards. So that's just one of the things where, again, we just had received some feedback. We got back together as a group and we did update some language within the procedure portion of the policy here. So that is me going very quickly through the case planning policy. Again, I will say we tried to, we had a good group, lots of feedback. We sent it out. I did receive quite a bit of feedback from people as well. We tried to make some of those tweaks and adjustments. And that is what we bring to you today. So open to any questions or feedback.
John, thank you very much. Questions, feedback? Did a phenomenal job the way it looks, John. I will say, again, appreciate that. I mean, you look at even A1 and 2, these are things that we had talked about at CSAC. And obviously, I think everybody agrees that medium level or risk level client will come eventually, but there's a lot of factors that we have to look at prior to that. The LSCMI validation, the standardization or the supervision standards, as we look at that all play into it. So, John, thank you.
Yeah, and we definitely had those conversations as part of our group as well.
Any other comments or questions?
I guess I have one.
Go ahead,
Sorry.
Molly. Yes.
It's minor. We don't have to. Well, the question I have here is the one exception to kind of the shall use is around the LSCMI because we've agreed to use it.
Mm-hmm.
So I'm just wondering if that discussion happened or we need, want to have it, which is, I mean, I love that we have options with case plan. I think that was all in the spirit of what we've talked about. So that's great. I just wonder if, using the LSCMI in case planning is more of because that is part of obviously the LSCMI, right? So is that a not as a such as in that particular part?
No, I don't disagree with you. I think it's one of those things where it probably should be a shall. If we're looking at the validation of the tool and that driving also like the populations that we're going to target as part of case planning. I think what we're trying to kind of make sure we're not boxing everybody in, and this is the have to language, but I want it to look like, I think what we could say is that it's the shall around the LSCMI, but we also know that there's other tools. And even at the MACAC table, right, Molly, there's been conversations about making sure that counties have that ability to, if you see a tool that you want to incorporate into your agency, that you should be able to do that and then have that drive some of the work you do. So how do we make sure that it's like the LSCMI is the base, and then you have the opportunity to, build on that by utilizing other tools as well.
Yeah, I agree.
Let me jump in real quick on that one, just because we don't have the risk assessment policy in front of us today yet. And that will be coming. And I think that that's the one place, the one thing I know that group is talking about is whether LSCMI has to be done for sex offenders or whether other tools should be the baseline tool for sex offenders. So I'm kind of wondering if we should leave that decision to the risk policy rather than putting it here in case planning. Like case planning says it has to be based on a risk assessment. The risk policy will say what risk assessments you have to use when, and when you have the ability to vary. I don't know.
I kind of agree.
Makes
'Cause-
sense.
and I'm not a WERNA expert, but our agent that's trained on it said she uses the WERNA for case planning with her females a lot more than strictly the LSCMI. So I'd hate to kind of box somebody like that in. And anybody that maybe is a WERNA expert would maybe be able to respond to that a little bit more, if that's a correct statement, but that's at least what my agent has responded to me. So.
Yeah, and I agree. I think that makes sense. We can defer that, and if we need to come back to this policy to, have it more aligned after that's considered, it's more of a, the general responsivity tool is almost like at a minimum, right? But not limited to, is probably somewhere where the language, and if it's in the risk assessment, that makes a lot of sense to me. Because you're right, then whether it's a sex offender or the WERNA or something else, even if you rely on it more, we still know that at the base, a lot of these general risk need responsibity elements are in the LSCMI, right? And so, anyway, just food for thought for that next policy.
Yeah, no, that makes sense.
Go ahead, Kelly.
I was just gonna say I do kind of like the way she said that, like at a minimum.
Yeah.
LSCMI, something like, so maybe that is the kind of tweak that we make. Yeah.
Yeah. No, and I do like that the risk assessment policy could help drive what this looks like. And I think that would be helpful. It's just when we're, like we all experience, we're trying to build these things at the same time. It becomes a little disjointed, but if we can allow and we were talking about this in regards to, I think maybe supervision standards, it's like, well, some of these things are going to come together with the other policies. And it's like going back even to our definitions weren't matching, and we should have one set of definitions as a state that drive then what's written in your policies. And so when we can get these things to start matching up, they will flow. And I think that's what we'll get to with case planning as well. They'll flow once we are able to kind of define these things a little more clearly. So allow risk needs assessment group to help define what we're going to do in this regards to the assessment driven approach portion of the policy.
Well, and good point. And actually, Tracy just noted even the applicability is not consistent between the policies either. So we probably want to make sure in looking at all the sections of the policies that were kind of consistent through all of it.
Because I feel like, there's got to be portions of these policies that we should always be very consistent on. And, that's just been this experience as we've gone through this, is seeing others. And I'm like, oh, like that's kind of like ours, but it's not exactly the same. And boy, we really probably need to establish that base of applicability and definitions, should look pretty consistent across the board.
Yep.
And I'll just jump in quickly that I do want everybody's eyes on that. I appreciate you raising that and bringing our attention to it. We should all do our best to line it up as best as we can. But then the DOC policy team will also try to do that. So they'll be hopefully our stopgap, but we know the business better than they might. So we should be giving them the best product that we can to begin with.
And I don't know if this is the best time, just because it's not related specific to John's comments, but we also wanted to maybe take a look at, we addressed in some of the policies, it should be CCA, DOC, and MACAC, but what about the tribal nations? We can't dictate that they do that if they are doing probation delivery system, but we can encourage, we can, whatever. So I just think we need to address that at some point too, when we talk about the, yeah.
And I was kind of in and out as we were discussing the other policy. Was there a mention afterwards too about the definition or no definition of evidence-based practices in the other policy? Or did I miss that?
It was integrated. They were saying that the term integrated evidence-based practices wasn't defined.
Gotcha. I was just, thinking of the definitions as it relates to what we have in ours, and I just hadn't looked and seen what was in the other one, as it relates to evidence-based practices. So I'm just looking for that consistency.
Yeah.
Thank you. Tracy, you got another
Are
comment?
those definitions in a current DOC policy that we could?
What
was
I
wondering if-
know from what I know when we were defining a couple of things, case planning came from Carter. So that was some of the feedback that we received after our first draft went out, was he pulled in the DOC policies as it relates to those two items. And that's what we incorporated. I don't believe, I would say that most of the other ones were, I believe, pulled from other policies, and are fairly consistent with the other policy that was presented today. But I'd have to set them side by side again to do a look through and to see where we were consistent and not again. But I know 3 or 4 were off, but the 2 that I know we took from DOC were case plan and case planning.
Perfect. Any other questions or comments for John? Hearing or seeing none. John, thank you very much. We appreciate the work that you and your committee do. So,
thanks, John. Thanks, everybody.
Next, behavior response grid memo. I think that's Tracy, right?
Yes, thank you. First, I'll say this is not a draft policy. This is just a memo indicating the shift, and it's a pretty significant shift to what was previously recommended to this CSAC committee. So as a subgroup of the JRI, we took a look at this, and if you think back, these recommendations for an incentive and sanctions grid guide came 4 to 5 years ago with the work that was done with JRI. And as we've moved along, we've kind of modified that. And when this subgroup got together, we really took some more recent research and took a look at where we wanted to head. And I'm glad that I came after the coaching and the case planning policy, because after hearing all that they were talking about, and as we built this memo together, it is really meant to be integrated into those things that we're already doing or proposing to be doing. So the memo is really, talking about the purpose. Like, this is a significant shift to where we were headed just 6 months ago, right? And so why? Like, why is the rationale for that? And it really is going into the research and looking at structured sanctioning, and sanctions in and of themselves don't necessarily promote more positive outcomes. And so you'll see on this memo that the purpose and the rationale explains kind of what we went through and some of the research that we used, and that we wanted to focus more particularly on incentives and more focusing on integrating our responses within kind of that case planning within the R&R model, and make it more individual, make it more related to criminogenic needs, to be doing more therapeutic interventions versus that external kind of sanctioning grid. So you'll see the first couple pages really go into more of the explanation of that and why we came to kind of this idea or thought moving forward. The third page of the memo really talks about the elements of what we see, and we really want to see those cognitive behavioral interventions as core practice. So really integrating our responses to clients' behavior in that case planning process, and talking with clients and using interventions and incentivizing clients based on their individual needs, their individual case plan, their goals, and their motivations. So the key elements are really using cognitive behavioral interventions as a measure, right? As building those problem solving, identifying those things within that system.
Ooh. Oh.
That's not what I meant to do. All right. And then integrating incentives into that case planning, right? So taking a look at that individual client's personal goals. And then recognition of progress. So when we are working with a client, we have clients that are all different levels, right? So really focusing on the progress in their high risk domains, in their criminogenic needs areas, and identifying the reinforcement that correspond with that. So really tying that all in. And if you think about an agent's work, this is really you're in that case planning process. You're in that 4-step model of appointments, and you're working with that client. And we wanted to remove the idea that you would leave that and go to a whole nother system to mark an incentive or mark a sanction or mark something else, that you're really working with that client in that level. And so it really ties it together for both the client and the agent as well. So that our interventions are based on their behavioral concerns, right? So progressive sanctions, we still need to use sanctions, right? But that they're used when necessary, but they're clearly articulated, and there's an individual approach to that. Also, we have seen, and the research has shown that sometimes when you're using a kind of a more sanctioning grid type area, unfortunately, sometimes practitioners tend to sanction what should be therapeutic or treatment, and the client is seeing that as a punishment rather than a therapeutic intervention, right? So tying this into that case planning really kind of puts that all together for the client. So we wanted to discourage the use of any kind of services as seen as a sanction versus an intervention or an approach to improve outcomes. So like really taking away the idea of using a statewide grid, but that the future tools or automated tracking systems would include the capacity for customization. So really you're tracking that within that case planning piece. So that's the elements of kind of our new proposal of how we move forward with that. There's some key changes that will just kind of identify, what we had started with and how we've modified, removed, or expanded that to this new idea or approach moving forward. Implementation, it remains to be seen, right? We have some case planning in CSTS. We have some things going on, and we'll see how this kind of moves forward along with all of the other things that we have going on. But I do think this kind of ties nicely with what is being developed right now. So first off, implementation, we really need staff training and communication. Again, it goes back to the training and the case planning approach. We already have a plan for everyone to be trained in cognitive behavioral interventions, in motivational interviewing. A lot of that is occurring at Statewide Training Academy. So more adding to that with this approach about this communication, about how we incentivize and how we address behavior through those interventions, right? So it ties into that. We would recommend like piloting this, right? Trying it out and seeing it in a few pilot sites or specialized areas. And doing that, if you've been through ACJI implementation science training, kind of that plan, do, study, act, kind of just take that in cycles to gather data and see how this approach is aligning with our intended outcomes. The subcommittee doesn't anticipate or wouldn't promote a separate policy regarding this, right? It would be integrated into our already existing policies. When we talk about kind of that standard statewide supervision standards, when we talk about case planning, when we talk about all of those things, this is just built into those. And just one example is our current community supervision policy has one line that says we will incentivize or sanction clients appropriately, right? So we can expand upon that within our existing policies to incorporate this in rather than having a separate standalone policy. And as far as monitoring and valuation and getting some audits, so if we can build in the language, and Jake is much better at knowing the CSTS functionality and things like that, so he can step in if I say anything incorrectly. But as we build that case planning module and other templates, we can take the pieces of this and really incorporate and take some key metrics like keywords and use a template to then be able to pull from CS to like keywords that we're using. Like, are we using the word incentivize and where is it located? And that we can build that into the system in the future for those metrics. And so then I think just education to our, our staff and our community partners about, this is pretty new approach, rather than, really, I think all of us in corrections have gotten sanctions down really well, right? We know how to sanction people. This is really more about how now do we incentivize them and how do we build that into our case planning approach so that clients feel validated and, they are incentivized to move forward and their accomplishments are acknowledged. So there wouldn't be a formal tool. It would just be built into our already existing processes. I can go on and on, but ensuring consistency and uniformity, we're still going to need sanctioning, of course, right? And that is still based on a client's behavior and their risk and the risks they pose to the community. And so there's certainly agencies can still use that and should use a systematic approach to that because we don't want to also over punish or over penalize clients. So there should be, but then there also should be a redirection back to that intervention, right? So maybe there is a sanction, but then we redirect and back to those cognitive behavioral interventions to address the behavior behind that. So that is the thoughts, and it is a significant shift from where we were 6 months ago. And you can see in this memo, there is some more recent research that would support this approach that's been listed in here. And I think this aligns with kind of the other things that we are approaching as we do our case planning, as we do our training and coaching. I think this ties in nicely with the way that we are headed as a whole.
Tracy, thank you. Questions, comments?
Does anyone else have their hand up or? Go ahead, Becca.
Just a comment that I just really, really appreciated reading this memo. And this is the definition of evidence-based practices, right? We have been presented with new evidence that is completely intuitive to what we assumed is an overly punitive approach does not change behavior long-term. So this was just really, really exciting to read, and I really, really appreciate it. And I would love to see it maybe in facility as well as moving into DOC and stuff, especially with MRRA and things of how sanctions and disciplines and stuff really can affect people long-term in terms of getting being eligible for certain programming and things like that. I just really, really appreciated this and thank you.
Thank you.
Tracy.
My question is just, is there a separate policy that will be addressing interventions and responsivity? Because I know there's movement on CSTS where the interventions and response are going to be pulled into probation violations. And measuring that data. So I'm just wondering then.
There's not the intent that there is a separate policy
for you guys, but are we addressing the interventions and responsivity somewhere else then? So that we are having controlled data that's being pulled into our violation reports?
We have outcome reporting for violations, but specifically, does it tell us what the actual recommendation was from the court. Not that I don't think it's that granular. So when a violation is found either through hearings and release or through the court, there's outcome reporting that is completed to show what was the disposition of the hearing. You know, but it's very simplistic. Was it revoke? Was it jail? Reinstate with conditions, etc.
Yeah, but from if we've done interventions internally with the client, CSTS is being set up to pull those to show the court, we've tried this, we've tried this, we've tried this. So do we need any kind of standards on those interventions? What are we?
We don't, yeah, I don't think there are standards set in relation to in the violation module. There's like, what did we do?
Yes.
Short of, obviously prior violations, but there are some things that we've done short of that. So I don't think there's established standards. And I don't believe that's a reporting field at this point. It can be, but that's a great question because we talk about standards. And I think similar to what Tracy was talking about too, is like, if we're going to want to pull data, keywords, but we have to all be saying the right word.
Exactly.
And so there'd have to be standardization in the types of fields and outcomes or in relation to the type of interventions that were short of a violation that were utilized.
Correct.
Thinking reports, et cetera, would be some of those areas. That's a pretty short list, but there's more.
Or sanctions conferences or all those different things that we've tried first. So do we want that somewhere in policy saying these are the interventions?
That might be a standards committee, I think, conversation, Jake.
Yeah,
I don't know where that falls.
Yeah.
Probably
Yes, but-
CSTS data standards and exec, it'd probably have to fall within from the CSTS data committee as far as, reporting on that data, then it kind of bounces back and forth between that and standards to say, we have to eventually get to a point to lock down what is it we want to put in there and how do we want people to put it in there.
And I think tied to that standards, I think the proposal is then there's that, once we have those standards, then that additional training, that they're training on case planning and the training on all of that will lead us to like, here is how you chrono that, or here is how you identify, not chrono necessarily, or how you write in that case planning so that you can pull those key words out.
You can,
So that'd be that
each agency can draw their own data out on that particular area, but it's going to be, a range of, you've got to more needle through all of that because everybody's going to write things differently. But I think that could be a directional arrow to start working towards, do we want to start identifying the interventions utilized?
What things do we want to show the court, or what things do we want to measure that we have tried? They might be a sanction, or they might be incentive. We might incentivize them for doing this really well, or we might have set up we met with them more frequently, or what are those, showing those things that we've done and somehow.
And I think Jake hit on it too. I mean, we're talking, if you're to incorporate this, then you're also talking about, did we assign homework? Maybe that's a key word. What kind of thinking reports were done? What kind of those interventions, those cognitive behavioral interventions were taking place?
I think you guys are getting a little in the weeds of recording, because we're here to sort I heard your question as, do we need a policy and what interventions are appropriate? So I'm not sure where your question landed, but that's probably where we should be discussing it here. And then those types of conversations can take place at the CSTS committees, if that's all right.
Are we okay with that? Well, we have a data committee meeting, I think, coming up in the next week or two. We can bring this topic to the data committee within CSTS, which at that point, like Jake said, might push it to standards committee and the exec committee for conversations. So,
and that is part of it, but I also am thinking, what do we want to encourage people to do?
Right, that's
part of sanctions and incentives. And if we're not having a policy related to sanctions incentives, how are we encouraging people, and what are we encouraging people to do? It doesn't have to be a grid per se, but.
So Molly's had her hand up for a long time.
Thanks. Well, having been one of the folks in Heidi Rademacher developing that sanction or the behavior response grid, I'm hearing it a little bit differently, but before I make assumptions, Tracy, are you actually asking for those of us that are using the CSTS behavior response grid that does draw up into our probation violations that we've found has been helpful with our bench? This doesn't preclude us from continuing to do a grid if our jurisdictions want to. We're just hearing that the group from a state level isn't going to require it.
Exactly.
That's different than the interventions module. That's different than the PV module. So I'm here. That's what I heard you asking, Tracy, is like, you know, this particular element is drawing up into our PVs for those of us that are using it. Is that what you were asking?
Yeah, there would be no, you would be able to do what you choose to do in your county. There'd be no there's no recommendation from our subcommittee for a statewide grid such as you're utilizing, right? It would be, this would be built into other areas.
So backing up, first of all, I want to also appreciate the extensive research and thought and conversations that went into this. It's impressive. It is right. It is the way in which we know case planning and that one-to-one work with clients, you know, really should be very individual and nuanced and make sure that it's appropriate and tailored and all of the things, right? And so again, I overall support that and appreciate that. I do want to just comment on or ask the question around the conversation. A lot of the research that was drawn out in this memo was around those that are using really sanction only grids, and that there's a lack of research around those that really do both. And so I agree that the sanctions only fall short in that when we just focus on that, we don't have the positive outcomes. And yet we don't necessarily have, you know, a robust literature around what happens when you do both well and what does that look like. So I was just curious about any of the conversations the subgroup had around that.
We did have that conversation, and you're right. There is not a lot of research that incorporates both, right? Because that has not been historically what was done. And so we didn't have a lot to draw on from that. And so that is where we, you know, came to the idea of that those incentives should be documented through that kind of that case planning process that we do need to document incentives, right? But within the processes that are already in place so that it is tailored to that individual's particular plan.
And that makes sense to me. I think there's also the element of the, not even just incentives, but the, like the affirmations and the acknowledgement of what is reached, right? That I think was the intention of doing a overall behavior response grid when you include the positive overall, not just the incentives to reach. So I just put that out there that it's like, I agree, we shouldn't do just a sanctions only. That was never the recommendation by the commissioner, was do a sanctions only grid. It was to do a response grid. And if we don't have enough research on the other end, are we making that jump too soon is my question, versus trying to do a robust overall system that incorporates everything you have in the memo, but also how do we capture that? And then the second comment I want to make on it is that there's other, back to Tracy's, I think Tracy's points, or one of them anyway, is the benefits to our, like the rest of our justice system that I've noticed moving forward. So again, I went from a county that was using sanctions only grid to no grid to now both an incentive, positive, you know, a response to sanctions. And one of the pieces that we have found with our data is that there is research around swift and certain sanctioning especially when you bring formal, you know, reports to the court. And we were having PVs drawn out months and months and months without any response. And a lot of it was because, and this could be, every county is unique. So I want to say that, but I think that what I noticed in, you know, the county I came from and now is that when you have common language, which you could, I mean, it's harder to share a whole case plan, nor do we want to in court, right? And when you put everything in a narrative of a PV, we know that sometimes people are prepping real fast. And so all I'm saying is that I think there are some other communication benefits that help our clients and overall when we're able to showcase what we're doing in the community, that we're exhausting all of our community resources and we're rewarding behavior. And we have actually seen some really great results from the bench. And I don't mean that in a sanction sort of way. I actually mean that in a really positive, like treatment sort of way. And so I just want to make sure we're not missing something else that could be really beneficial. by not doing it. And I also stand by the fact that we can do, you're not saying we can't do it either. So just certain jurisdictions can choose to continue that if it's working.
And I think the recommendation in here is, yeah, there should be a systematic way of approaching this, right? So how Scott County approaches it, it should be systematic. How there should be a systematic approach.
Thank you, Molly. Any other questions or comments?
I have one.
Really?
Just sort of listening to all of this, it's making me wonder if there should be a line or something added to the case planning policy that basically, I know like earlier you gave like the one liner, I think this might be in DOC's policy, that we will incentivize or sanction appropriately. And I just wonder if there should be something added to how the case plan is built, you know, a description of it. The case plan should, like it says right now that it's has to address criminogenic needs, but maybe it should also say it, you know, it should be building in interventions and incentives as appropriate for the client's that situation or whatever. I'm just wondering if that's
makes sense.
maybe a place to
Yeah.
incorporate some of those concepts that you were talking about.
Yeah. And I think John and Kevin, everybody mentioned it, as our subgroups kind of come together, now we're seeing everybody's work together. I think there is probably a lot we can do to incorporate those things in the work that's being moved forward. But that is a great idea.
I think Kevin, being the chair, could probably bring that back to their subcommittee for us, right? Or, I don't know if Tracy's on both of them. You're on.
The JRI, so the case planning
You are
and the
perfect, so
behavior
Tracy
are
can
both.
as well, so perfect. Thank
Yeah,
you.
I got a little
Yeah.
pull there.
Thank you. Yes. Other questions or comments? Well, thank you very much, then. We appreciate it, all the work you have done. So on to recommendations on the development of a pre-screener with Tessa. Hello.
Will you, Don, are you able to pull up the PowerPoint?
Yes.
Thank you. Pre-screeners.
Want to introduce yourself?
Oh, yes, I'm Tessa Nelson with the Department of Corrections. I am a district supervisor in the Center City District. That's what it's called now. And I am a co-chair on the Risk Needs Committee. And last month, or actually last week, it was last week, this was presented because there was a subcommittee. So they presented to the larger committee, and we are moving it now forward to this committee. So they were tasked with looking at developing a universal screener, pre-screener for Minnesota. And one of them that they settled on was the Oregon Public Safety Checklist, I think is what it says. And from which the idea was that Minnesota would create their own universal adult screener tool. We have evaluated availability of data in Minnesota, assessment feasibility at the least particularly automated tooling. So we were hoping,
Maybe
there we go,
one's
that's
closer.
easier. So we were hoping to have an automated tool and then proposed tool design and elements and boundaries. So that's what they were tasked with doing. And here's a review of the Oregon Public Safety Checklist, which actually looks very familiar. You can go on to the next page. It looks very familiar to some of the other risk assessment tools or pre-screen tools that we see that a lot of people use across Minnesota. Some of the factors that they liked was that it had the ability to be automated. And also that it looked at some past and present. One of the questions on there, I don't know if you can see it, is it looked at within the last 5 years. So not only history, but the last 5 years. So I don't know if you want to go through them, but their age genders, some things like that. Age at first arrest, again, some of those are very similar from typical pre-screen. Any prior revocations, any incarcerations, multiple custody cycles, and then previous sentence types, such as probation, incarceration, if they've been to prison. You can go on to the next one. So some of the checklist items that they were looking at, Minnesota doesn't have a great collection of arrest data. Well, we do have some charge-related disposition information that comes in from MNCIS integrated and CSTS into our database. We also have statewide things like that. Would want to explore more offense types to determine what is the most predictive in Minnesota. Research should explore all offense levels and probation survey offense groupings. So I think there's been a lot of talk about misdemeanors and which kind of groupings. Concerns for questions that clients can't control. So if you saw on the last page, it had the first two was age and gender. And the resolve is to, by not putting those in the research model, that will produce screener questions. Sentencing change over time. So use type of stay. Do you use the stay or do you use what they were originally convicted with? The first and post sentence. And generally avoid current sentence information, including diversion due to significant variation with the practice statewide. Again, so kind of making sure everybody has a common language and using the scoring guide so that everybody's doing it accurately and consistent across the state. So charges versus pleas versus actual convictions. You can go on to the next one, Don. The data availability, Minnesota has a robust defense data that can be imported from MNCIS, like we said earlier. We can pull that information into CSTS, which is very helpful. Offense data is coded in CSTS for type offenses behind the scenes. As you know, when you pull it in, it has the petty misdemeanor, misdemeanor, gross misdemeanor, felony, and it pulls that data in to CSTS for us. Minnesota has a process to transfer assessment data from statewide to CSTS that could be modified if needed to support access to data for screening questions. So some of the questions may already be in there. Additional data elements in statewide MNCIS, COMS, PRISM can be explored. So ideally, in an ideal world, we'd be able to use our other resources and be able to pull this information. Such as prior incarceration, revocation from MNCIS, things like that. COMS and PRISM and CSTS integration would need to be built if that data would need to be collected for everybody for the pre-screeners. Go ahead, Don. Tool design, because this is something that would need to be created. Ideally, we would create an automated screener using largely official records, and it would not require an interview. I think that is probably the largest appeal to most people. The tool would be produced within CSTS, so it's a tool we already all have available. So it would be nice to have an automated system and utilize a tool we already all have. The screener would be predict general recidivism, same as the LSCMI. New misdemeanor conviction or above exclude petty misdemeanor and low-level non-targeted traffic-related misdemeanors. Screener and LSCMI should be well correlated and require research team to use the results of the LSCMI state pre-screener that's being conducted right now. It's the validation. So it would connect with that. So the screener would have two outputs. The LSCMI is required for agents, yes, no results with questions, answers per client. So again, simple, it's either a yes, no. And then low, medium, high results align with LSCMI for administrators as well. So it would be similar to simple yes, no questions, and then the low, medium, and high. Research
Can I jump in on
Yes,
that one?
please.
I'll just jump in because I did sit in on most of the meetings of this subgroup. But what we were thinking of here is, the pre-screener is really the tool to tell you whether you need to do more with this client or not. So that means that, if you're not, if you weren't going to conduct a full LSCMI to begin with, this will tell you if you should, right? So that's why the number one there is just for, the view that what we're thinking is the view the agent would see is like, yes, the trigger has been hit. You need to do an LSCMI on this client. But we also know that for the funding formula, we need to know risk assessments values. We need to know what the makeup of our population is. So we want this to be in the background, the low, medium, high, so that we just have those statistics to be able to report that to the legislature and potentially build that into the funding formula going forward. So
will they be consistent though? Because this is a screener, so those numbers don't seem like they would be necessarily consistent with a full LSCMI then. So
that's why earlier we were you can get this to correlate with the cutoffs for the LSCMI. Hennepin has done that apparently. So I don't understand that part.
Yeah,
that's
exactly.
not my bailiwick, but their recommendation is to try to get it to align with the results from the validation too. So we'd have that same.
Thank you.
Research will explore accuracy and equity for the following subgroups: gender, race, geography, persons of current charges, offenses such as sex offense, domestic, and I can't see what's behind that box. And you guys didn't see I think it says
domestic and DWI.
DWI. That would make sense. That would make the most sense.
I printed it.
Oh, smart. So this is what the committee is looking at for the risk needs group approved it and is bringing it here. So I'm not sure. I think the next step would be if approval happened, then we would take it to research and development. Creating.
So questions, comments. I will say I like I like the automation piece to it. This brings me back to the conversations many years ago with the the MinStar C. I think Molly was on that committee with me back then. If you remember that, for those that were on it, and the idea was having a Minnesota-based that was automated in CSTS. So I do like that function for the pre-screener in there. So that's great. Becca.
I have some concerns with these the things that we're using, like system involvement for folks. I mean, we know that is going to be disproportionately marginalized populations. That it's just they're just going to reinforce each other as a risk assessment tool. Is the number of arrests, the convictions, the length of your sentence, all of that we know disproportionately affects marginalized groups. They get longer sentences, they're more likely to be arrested, they're more likely to be convicted. So using that as a tool, and I don't know that it doesn't seem to line up with all of the evidence-based practices and the interventions and the case planning that we're putting into place. We're talking about criminogenic thinking, we're talking about cognitive behavioral things as the drivers of change and risk. So I don't see this screener as really getting at any of those things that we're addressing with interventions. We're just looking at, system involvement essentially, which we know is just completely subjective. So yeah, I have some issues with that as a screener. I don't have alternatives necessarily. I'm not a researcher. I don't know what the what those things are, and certainly making it automated. I don't know that we're ever going to get something without bias if it's automated, but yeah, I'd love to hear some thoughts.
So I can briefly talk to that, but what I will say is that it is a pre-screener, so it looks at taking those who score really low risk and not doing any additional assessments with them, unless there's some secondary assessments or things like that, I should say, or trailer tools. But it helps identify those that are considered high risk based on that category that would then warrant a full LSCMI. And a portion of LSCMI does include criminal history as well. But that's just one portion of a full LSCMI.
Becca, that kind of got to my question on, I was very curious that it scored high or low, medium, high, because that was kind of getting to that question that came up there. Because I was very, it surprised me that it would do that, because that's what a screener is. It rules out on all the low risk clients. You don't have to do the full risk assessment. And then when you do the full risk assessment, they may still score at a low on the full risk assessment, but it actually reduces, it takes those that you don't have to do it on and screens those out. And that's, so that bias piece to it would be eliminated at the full LCMI or the full report piece, I guess, if you want to say. There are static, as Tessa mentioned, static factors included in the full risk assessment as well, such as that the prior record, probationary experience as well. But that's only a portion of it, a small portion of it as well. But yeah.
Yeah, I think I'm thinking also who would come in automatically as low, because like I'm thinking particularly with domestic violence, you know, there often isn't a history, an arrest record history. There often isn't system involvement because of the dynamics involved in domestic violence. And so someone might come in as low, might not get any more risk assessments, but it turns out the whole time they're on probation or whatever, they have been harassing their victim or something like that. You know, I'm just thinking of how it just doesn't quite capture a lot of the dynamic risks in play, and we can be ruling out people automatically because honestly they're white men who have never experienced system involvement prior to this, but they're maybe more dangerous than the initial screener indicates. So just some concerns.
And well said too. The LSCMI actually would not score, as we all, or those in the field, doesn't score domestic violence offenses properly as well, along with DWI, repeat DWI offenders. That's where that ancillary tool we talked a lot about, such as the IDA, which would be DWI specific. There's also specific for the domestic or the intimate partner violence related offenses as well, sex offense cases as well. That's where those ancillary assessments come into play. Yes, I'm sorry, Kelly.
No, I thought that's a good comment, John. So I do think that's part. So like there again, the risk team will need to think about that with the risk policy, I think. But the other thing I was going to say is, so what the earlier slide said was, what the group did is they looked at what Oregon, and we had a presentation on this tool like last year, but Oregon uses their automated tool to do that some initial sorting and to tell them, you know, what's going to happen or where does this person go next. So that's why we started with their tool. But we went through and what the slides are doing is really saying, okay, well, that's the tool that they use, but we have some additional direction that we would like the research team to focus on when they develop a tool for us. But we were just trying to figure out feasibility, like, is it feasible to develop a tool here? What other things would we want the research team to consider? Do we have data that can help create a pre-screen? And we found that the answer was yes, we have the you know, research ability, we have the data, but we had areas we wanted them to look at. So I mean, I feel like we did, that last slide was like, look at specific areas like domestic violence and DWI. So what we want to know, Becca, is if somebody came in and scored a certain way on this tool, did they recidivate? You know, that's telling us how accurate it is. So they come in low, they have that recidivism. That's not a great score, you know, or that's not a great outcome following from that. So I think we can initially try to address your question in multiple ways by number one, having the research team look at those potential outcomes. And then number two, looking at when we get to the risk policy, looking at what kind of direction is given for special cases like domestic violence, DWI, like do we have any additional requirements in those cases or not? So I think that's where we would address that, if that makes sense. All valid concerns though.
Absolutely.
Yeah.
Other questions or concerns?
Do we have funding available to move forward with this?
We think we can, well, so first of all, what the team looked at is we have expertise within DOC to develop a screener. So we can do that, but we would also want researchers from other agencies to be working alongside DOC's research team to help, you know, to be the second set of eyes, to troubleshoot, all that kind of stuff. So that was sort of the direction that we were looking at going.
Okay. So the Oregon's public safety checklist isn't something like we have to contract with them.
No.
We can create that within our own state research teams.
Right.
Perfect.
Yeah.
Other questions? So
We would make our own, like we would look at making our own using the outline
Similar.
of what they have, but making sure that it fits for Minnesota population.
Right.
other questions, comments, concerns? Hearing none, Tessa, thank you for all your work you and your committee did, and thank you for presenting. So
I have to ask for an extension. Is that going to be part of the next part?
I think
the
we'll
policy?
take care of that. We didn't have to talk about it here. Yeah.
Okay. Can I ask a question regarding that though? Is this an appropriate time? Is that okay? So with that policy, the risk needs policy, and as I'm listening today and I'm hearing how everything's kind of being done parallel, can I ask the question of case plan, as that's kind of the end stop, right? So we have all the assessment pieces, and then we have how case planning ties in. On the case plan portion, it says that plans must target all 8 or central 8 criminogenic needs. Would that be intention for sex offenses? I think that's going to help guide then what the risk needs assessment needs to do. Maybe that's just a popcorn question. Maybe that's a food for thought. Because I think if the answer to that question is yes, the intention is that those who have sex offenses will be case planning around the 8 criminogenic needs, or the central 8, then I think that changes then, or that determines what we will be doing in that work group. But if it is no, you are not going to case plan around that because research doesn't support that, then I think that'll help guide us into where we move for the risk needs assessment or risk needs work group.
I think it would go the other way, that we'd be relying on your team to do the research and bring forward the state of the art on, you know, what should we be considering on that front, and does it impact other decisions that we may have made?
Okay.
well said. I think those.
Molly has her hand up.
Molly, go ahead.
If I could just ask the group to, because I might just have outdated research from when I was doing this, is my understanding, Carl Hansen, who was one of the authors of some of the sex offender tools, I saw, like, I've actually gone to see him speak and such, and when they talk, him and some of the co-authors, they talk about this particular area. They agree with yes, there are a lot of times that sex offenders won't pop high on the central 8, let's say, right? But there's a whole lot more that we need to do some case planning around. And there, if you have somebody though that so the recommendation I always heard was to do both, but then it could be that you're not, case planning around the central 8, you're going to do these other things. However, the type of person that is high on an LSCMI and high on the sex offender tools is like really, really concerning, right? Because now you have these general criminogenic needs and some of this other stuff. And even if it doesn't happen often, you don't want to eliminate, using the LSCMI. You just may, if it's low, go to this other tool, kind of like some of these other supplemental tools. And so I guess my question to the group that's doing the research and current experts is to just vet that out a little bit to make sure that we don't miss something if we just say, you never have to do the LSCMI with this population. Is it that we do it and we do something else to make sure that we're properly case planning, all things? That's my kind of thought on that.
Yeah, I will make sure that we talk about that. Okay. So bring that back to the group. Thank you.
Perfect. Any other just general questions or comments? Then we will move on to, are we on deliverable review or am I missing my own mind around here? No, I'm sorry. Kelly, I think I hand it over to you next, right?
Yeah, so 5A is this piece about extensions required. So what I wanted to call everyone's attention to is that when, last year we had a whole list of deliverables. We reported them to the commissioner. The commissioner had to respond to us. And all the policies that you see today are the result of that response where we were recommending policy and the commissioner said, yes, I agree, go ahead and create that policy. The timeline that the commissioner had proposed was that CSAC would review those policies in July and submit them to the commissioner by September. A couple of our teams are still working on those policies. So one of those is the intimate partner violence policy. It's really the, I don't think that, well, the domestic violence steering committee brought forward the guidelines for reunification for intimate partner, people who are involved in intimate partner violence. We had endorsed those guidelines for reunification, and they had suggested that there be just a short policy on what to do in those types of cases. So they're expecting to bring that policy forward in August. It was supposed to come forward, this month, but they anticipate they're on track to bring that forward in August. And then as we just heard, there will also be a policy on risk needs assessment. When do you do those assessments? What about the use of trailer tools, all of that stuff? So that's still being worked through. There's a lot of thorny issues in risk assessment, as you can imagine. So they've asked if they could delay bringing that forward to us until September. So those are coming up. And I think that as a committee, it would be our due diligence to just communicate with the Commissioner of Corrections that we have a couple of policies that we expect to be running behind that schedule. The other ones are probably on track to be turned in by September as we anticipated. So that's the first thing that I just wanted to call attention to there. Any questions or comments or concerns with that plan?
I'll speak it. I have no concerns.
Yeah.
I think that's, these take time and it includes the collaboration with other committees. I can just speak on behalf of the IPV, the Intimate Partner Violence Committee. I am the MACPO representative on that. And we kind of struggled, that group, Tracy Hooterlick's on it too. We kind of, and we have a lot of people that aren't familiar with DOC policy, which applies to the CPO and MAC Act too. And so they got some of the people on the committee seeing the sample policy, which is kind of an overview of you want to do this. We've already approved the IPV. But then there's DOC policy out there like the intrastate transfer policy, which outlines step by step by step how you do the process. And so I think some people were hung up with a little bit, do we do step by step by step? Or do we then just direct them to use IPV policy or the IPV policy and training, et cetera? So what we agreed to do is have a subcommittee of those who are a little more in the corrections to help write that policy. So we're meeting, I think, next week to do a redraft to try to make it more overview versus step by step. So that's a little reason for our delay.
Yeah.
As we met and we had it, I felt it was too detailed and it needed to be more of an overreaching versus all the processes that are in the training. So
Sure.
that explains a little bit where we're at and where we kind of struggled with where to move forward. Would you agree, Tracy?
There was a lot of conversation about procedures not being followed.
Yes.
And just, I think that a while back, we had anticipated that if you wanted to attach the guidelines to the policy as an attachment, that's also possible.
Yeah.
So,
Okay.
you know, just take that back too.
Okay. So I think I feel pretty comfortable with where we've come that at next week, those of us who are subcommittee will be able to draft that and bring back for August.
Thank you. I appreciate your leadership on that.
Thank you.
Okay, and then I think we do have time then. Oh, I'm sorry, were there any other questions? I should have paused. Okay. I think we do have time then, Don, to kind of go through there's a couple committees that we didn't hit in this process today, so we'll get some updates from them and Don will share a little bit there. If you're on this committee and we hit something that you're involved in, I want you to chime in and give us like updates in real time too. So I'll let Don take over.
Sorry, just waiting for the screen to come up. There we go. So, the ISR policy for deliverable 1 is complete.
Oh, and I just want to say that that was approved by DOC's Executive Council. I don't know how, that was really soon.
It was signed by the commissioner June 25th, I think. So its policy is in effect.
Okay, so and I will I also want to say for this is a good point for me to say this for the committee. So we've talked a lot about like where, you know, the fact that DOC policy, now there's going to be these policies that apply beyond DOC. So we have a policy manual online for all of our stuff, and we are repurposing an existing chapter to this work so that it's going to only have in it the policies that apply to all delivery systems, so that it'll be easier to find.
Nice.
So the ISR policy is going to be the first one that really gets slotted into that zone, and because it's ISR is sort of like at the end of the supervision train. I mean, it's the highest level of supervised release. So after you've served your prison sentence, we're assigning it a number that's higher in the series so that we can make like risk assessment and case planning and all that. Like the lower numbers, kind of put them in chronological order in terms of when you would do this thing. So I just wanted to let you know, I'll make sure that we send something out to everyone so you can locate those policies. I don't know if this one's been posted yet. It was literally just approved. So, okay, sorry, Don.
That's
Go ahead.
okay. We've already talked about the IPV policy and a comprehensive full set of supervision standards that is in process by JR. So I believe we talked about both of that. The risk and needs we are pending. We did talk about the use of a pre-screener this time. Statewide pre-screener. And I know they continue to consider and make recommendations for supplemental assessment. All of that is in process. Challenges and needs, they met on 6th. Actually, this is an older one. the challenges and needs here. I don't know, Tessa, was that still an issue?
Submitted to you. So
That might have been an old one.
yeah, so we just need an extension until September.
Yeah, so this is being, this one is being rolled in with the main risk assessment policy. So originally it was going to come forward as two policies, and now that group is combining it all into one risk and needs policy that will address trailer tools as well as just when do you use the LSCMI. So I think that's why they're both delayed.
Yep. Okay. We've got, I didn't get any updates on study and recommendations for MinStar Beyond. And
So I can give a little bit of an update on that. Are you talking about the JRI phase 2 working group?
yes,
So the MinStar 3, the policy is with, I think the executive team is gonna review that in September. So that's already been, and there's some bit intern guidance already put out regarding that. So that's the update in that category.
okay.
That second piece, the recommendations for standard supervision. The JRI phase 2 group met last week, and they are doing a little bit of a pivot there and moving towards looking at the APPA standards that came out regarding supervision. And so that group will be asking for an extension up until December of 2025 to review those and come up with recommendations.
Okay, I'll make sure to get this updated. We did talk about the case planning. And with the prioritized developments of metrics, the CTS enhancements are on hold, as there are other prioritized enhancements. And then that is submit progress within 1 year.
Oh, gender responsivity.
Yep.
Is that you, Jake or
Oh,
Kevin?
yeah. Yeah, so that work group is still meeting. We have, we had a kind of a brief review with the community's, the EVP advisory committee. Got some feedback. I think we're really noodling on metrics and quality assurance right now. We started in March. Our group convened in March, and we've added members in May. So we're kind of a little bit behind with trying to get something which should have been last or this month, but looking for to provide something in a couple months so we can get full vetting through EVP advisory. So we're continuing to work on recommendations and trying to figure out a little bit more in relation to not focusing so heavily on training, but also for how responsivity, and we're using just the term responsivity, but focusing also on gender culture and trauma, how that is utilized within supervision and case plan, specifically case planning, in areas that we can further dial in. If we're training, are we doing? So we continue to work on that front.
And that covers the baseline as well?
Correct.
Okay.
Yes. Yep.
Sounds good.
The foundational training.
We did talk about the statewide behavioral response grid. And we talked about the coaching and training. And then Jake, any update in deliverable 10?
Workload steady. We've been meeting. We've got the leadership team established. We have a few meetings under our belt right now. We're focusing on a survey to start collecting data specifically around areas of supervision cutoffs, caseloads, levels of supervision, types of positions, caseload positions, including non-caseload positions, like if EBP training, safety trainers, like specialized positions that are not just necessarily carrying supervision caseloads. Another step will be working through the data sharing agreements through evident change. We'll be working on so we can collect they can collect the necessary data to kind of start diving into the further into the study. So I don't know, Molly, is there anything more on that? I think we're just still kind of trying to dial in the survey at this point.
Yeah, no, I thought you captured that really well.
Okay.
And that is all the deliverables that we're tracking.
All right, any questions from anyone on those items? All right. Item number 6 on our agenda is other business. So the one item we have listed there is committee vacancies. So we saw that 2 of our vacancies were filled. I think we're still waiting on 1. Is that correct, Don? Or where are we at with?
We are actually waiting on 2
Okay.
to be filled. 1 is for a judicial representative from Greater Minnesota, and 1 is a judicial representative from the 7-county metro area.
All right.
And we do also have a MIAC position vacancy. I have been working with Wendy Spry. They did not talk about it during the June MIAC meeting, and the August one is set for the end of August. So hopefully, beginning of September, we'll have a new MIAC representative.
Great. Is there any other business that anybody wanted to make sure to bring up today?
We have a meeting date for August.
Do we have a meeting date for August?
I should.
The only thing I would note, I thought at our last planning meeting, Molly and I said we both won't be able to be there because we'll be at APPA. So if we were going to look at an alternative date
Oh, were we?
or not.
So right now we have August 27th.
Yes.
Okay, there it is.
Fourth Wednesday of the month. So
4th Wednesday of the month. Yeah. So we have issues with that.
Molly, will you be, I know I'll be at APPA at that time, likely on a plane.
Yes, I do have a conflict. I was waiting to book flights because it's an important meeting, this one. So I don't know. I don't know what flights are available. So I was waiting to hear the answer to this question first. It would be a virtual no matter what, because yes, I would be at that conference.
What about, so I guess the question is, what do you all want to do? Is there a desire to look for another date? Are most people available on that date? How do we want to do that?
You're right. I mean, you change something like this and there's going to be people that miss. So, and then we have the two co-chairs here too. So I don't know if we, if you even want to entertain that. If you wanted to try one shot at it, is the Wednesday before same time work for people? If not, then we have, we should probably roll with what we have.
Yeah, CSTS executive.
Doesn't work for me.
Okay.
Would it, one question I do have though is, would it help if we moved it up an hour to 8 a.m.?
Yes, because I think that, at least, I don't know for John, because if you said you're on a plane, but that.
I'd have to look at my flight is. I don't know right offhand. I got to look. I already booked it, so I'm not sure, but it may work. It may help.
Because we're on East Coast time too, so.
Yeah, correct.
Are you? So that would make it 9 a.m. for you on the East Coast.
Right.
As opposed to 10.
Yes.
That works for me.
Would that work for other folks if we started an hour early? So basically the meeting would be planned for 8 to 11 instead of 9 to noon. I know you drive.
Yeah, that'll work.
All right, well, maybe that's a compromise we can make, and then
Thank
that
you.
will help out a little bit. All right. Don is probably cringing over there because he has to get up early.
Absolutely. No, there's no me. There's no conflict in this room beforehand, so it's not going to be a problem.
Okay, awesome. Great. All right, so we will do that. And then that's it. We always have room on the agenda for public comments. I'm not sure if there's anyone here who would like to say anything.
Yeah, there's no one online.
There's no longer anyone else online. Okay. We don't actually have any additional folks to make public comment. So with that, I think we have made it through all the business today. Honestly, I thought we'd be going right up till noon. So nice work, everyone. Remember, just one more plug, for everybody on this committee, you all represent some constituency. So what our ask is between now and the next meeting is that you actually have conversations with your organizations, your constituencies about all the recommendations that were brought forward, because next time we'll hopefully be voting on those. Bring your feedback to that next meeting. Like we'll want, if you've got language changes, we'll want them. I guess the other question is for policy language. When we worked in the ISR policy, we asked for that to be sent in ahead of time to the drafters. I'm wondering if we should set a deadline for that and ask that be sent to the drafters again here. Or do we want to talk about it first and decide within the meeting? I mean, that worked out pretty well, right?
Yeah.
It's helpful, I think, to have it in hand.
Okay, so how about if we have, we'll identify who those point people are, and then I'll ask Don to send a message out to the committee identifying the names and the contact info for all the folks who are the heads of these policies, so that and where to send that in. And then I think we asked for it a week in advance or 2 weeks in advance. What was it?
It was a week in advance. Yeah.
A week in advance.
Yep.
So that, all right, so we'll have Don send out an email. So we'd be asking for any policy change language a week in advance so that the drafters have a chance to review it and try to incorporate it or explain why that's not a good idea from their perspective. So we'll do that. And I think that's it. So unless there's any objection, the meeting is adjourned. Thank you all. See you next month.
you.